Please join me in welcoming Dr. Kerstin de Wit and her talk, Pulmonary Embolism, the Bogeyman of the Emergency Room.
One summer, when I was a medical student in Scotland, I was sent to work in a community hospital. The hospital was set in a beautiful green field beside an old Scottish town at the foot of 3 ancient hills. These hills had once been home to a Bronze Age fort and then a Roman fort, and were now deeply ensconced in the local folklore. The hospital was very small, and patients lay in their bed, gazing out of the window at the rabbits grazing in the fields. And nearby, the River Tweed slowly and peacefully meandered through the countryside. Every morning at 8 a.m., I joined the ward round, where doctors wearing white coats would all assemble in order of seniority, and they followed the staff doctor from patient to patient. It was the most junior doctor who was expected to push the trolley containing the medical records for each patient. The staff doctor would stop at the end of the bed. They would speak briefly with the patient, bark questions at the assembled audience, and then they would declare what the next steps were. An exercise test for the man who came in 2 days ago with chest pain, a brain scan for the woman who became confused last night, and a lung scan for the man who is feeling short of breath. The junior doctors scurried around in silence, sometimes adding to their work list for later in the day, and other times ordering the tests as the ward round progressed. We were wrapping up at the end of the day when the results of the lung scan came back, having diagnosed pulmonary embolism. You'll hear me talk a lot about pulmonary embolism, but for now, I'll tell you that pulmonary embolism is blood clots in the lungs. There was something not right about the scan report. It had the wrong patient name, and it took us 5 minutes to work out what had happened. The junior doctor had accidentally used the patient identification sticker for the patient in the bed next door and had ordered the scan on the wrong patient. So the patient next door had gone for the lung scan, and the patient next door had pulmonary embolism. And what about the man who was supposed to have the lung scan? Well, he didn't have pulmonary embolism at all. And instead, we'd accidentally stumbled on the diagnosis in his neighbor. This was my introduction to diagnosing pulmonary embolism. My name's Kerstin de Wit. I'm a professor at Queen's University, and I have been researching emergency blood clots for most of my career. Pulmonary embolism is a condition that happens when the blood starts to clot too much. Everybody knows that our lungs bring oxygen into our blood, but few know that our lungs are also our blood's filter. The lungs are supposed to remove anything solid that's traveling in the blood. So when the blood starts to clot too much, pieces of blood clot move with the blood flow, and it's the lungs' job to remove these blood clots, protecting us against a stroke or a heart attack. When there's abnormal blood clotting, the first place that blood clots show up is in the lungs, right where they're supposed to be. And this condition is treated very easily at home with tablet blood thinners. Occasionally, the lung filters become so clogged up with blood clots that the blood can't flow easily through the lungs. And when that happens, pulmonary embolism can become life-threatening. I'm going to fast forward in time 20 years after I was a medical student. I'm living in Burlington, Ontario. I'm working as an emergency physician, and my husband and I live in a small house in a road lined by rambling lots, backing onto a forest. Our neighbours are retired, and this is a close-knit community. In the summer, we all go to Dave and Betty's house to enjoy fresh Italian food and homemade tomato sauce. Betty and I exchange notes on the Orioles that we're both feeding, and we wonder when they're going to fly south. In the winter, we go to Ben and Helen's house to enjoy Helen's holiday decorations, to have a drink and exchange stories. Behind the hospital, I find a store that makes authentic Scottish haggis. So in January, everyone comes to our house for a Scottish burn supper. I was sat at the kitchen countertop working on a grant application when my neighbour Ben knocked on the door. Something was wrong with Helen. We walked across the road together, and I found Helen sat in an armchair, looking healthy and upbeat. She told me that she had felt short of breath walking up the stairs with the laundry. I took her pulse, and we agreed that she could keep her appointment for that afternoon with the family physician. 3 days later, I had a voicemail from Ben saying that the family doctor had admitted Helen into hospital. I was stood in Toronto Union Station, waiting for the GO train home the following weekend, when I had a phone call from my neighbour Betty. Betty told me that Helen had died the day before in hospital, and that Helen had died from pulmonary embolism that had been diagnosed too late to make a difference. And that brought me back in time to when I was a medical student, and all the doctors on the ward round had missed that one of our patients had pulmonary embolism. How could I have known that my neighbour Helen had pulmonary embolism? I work as an emergency doctor, but I'm also a specialist pulmonary embolism doctor, and I treat all the patients in our region who have this condition. And I've been researching how to improve testing for pulmonary embolism since 2001. I eat, sleep, and breathe pulmonary embolism, yet I missed the diagnosis. How can I explain that I, a pulmonary embolism expert, missed the diagnosis? Am I a particularly bad doctor? Do I lack diagnostic skill? And what is the impact of missing the diagnosis of pulmonary embolism? It seems to me that pulmonary embolism is commonly misdiagnosed because the patients that I see in clinic have usually been to more than one doctor before the diagnosis is made. Pulmonary embolism is misdiagnosed as a heart attack, pneumonia, or asthma more often than we know. But when the heart tests come back normal, and when the pneumonia doesn't get better with antibiotics, or the asthma doesn't respond to inhalers, the real diagnosis is made. Usually this delay to diagnosis doesn't affect physical recovery, but misdiagnosed pulmonary embolism can leave people with long-term anxiety and mistrust in the medical system. And very occasionally, in the delay to the diagnosis, the lung filters can become so clogged up with blood clots that patients die. To understand how pulmonary embolism is misdiagnosed, you have to know that pulmonary embolism can make you feel short of breath, it can give you chest pain, or it can cause you to faint. But by far, the most common symptom of pulmonary embolism is unexplained tiredness. And who here has never felt tired before? And I bet most of you have never had pulmonary embolism. The symptoms vary from one person to the next, and they are very common in people who book into the emergency department. If emergency doctors were to test everybody with these symptoms, the wait for the scan would be weeks or months. The system would grind to a halt, and people would have lung scan radiation without any benefit. So doctors have to use their clinical acumen to decide who to test. In my research, the strongest message that I get is that emergency doctors are anxious about missing the diagnosis of pulmonary embolism. Emergency doctors see their role as spotting serious diagnoses. They tell me that pulmonary embolism is the boogeyman of the emergency department, and they talk a lot about cases that were missed. Missing the diagnosis of pulmonary embolism is failing as a doctor. But paradoxically, the anxiety about missing the diagnosis is getting in the way of making the real diagnosis. Pulmonary embolism is a wicked problem. Only 2 in every 1,000 people booking into the emergency department have pulmonary embolism. The symptoms are suggestive of other conditions, and examination by a doctor is almost always completely normal. This is where I'd like to tell you about Dennis. Dennis is a retired app developer and a member of my running club. I used to see him taking club photos when we were working out on the track, but we'd never really talked before, and a common friend suggested that he reach out to me. Dennis was admitted into hospital with breathlessness and misdiagnosed as having had a heart attack. And it was 2 more days before his doctors realized that he had pulmonary embolism. And since that time, he'd followed articles in the newspapers about people who had died after being sent home from the emergency department with misdiagnosed pulmonary embolism. Dennis realized that doctors weren't always testing the right people, and he wondered if artificial intelligence could help. If the right people were tested, then lives could be saved. So we set about working on this together. We assembled a small research team with expertise in big data analysis and emergency research. We analysed more than 14 million emergency department visits in Ontario. And we discovered that every year in this province, there are more than 1,500 cases of misdiagnosed pulmonary embolism. We looked at the risk factors for people coming into the emergency department with pulmonary embolism, and we identified these as the person's age, their symptoms, the triage nurse assessment, having previously had blood clots, having cancer, and having had recent surgery. Then we put these risk factors into an AI model, and we found that the model helps predict who has pulmonary embolism. We call this model PE Nudge. What if PE Nudge could work behind the scenes in the emergency department 24/7? Every time someone books in, it would review the hospital records, and when it identified somebody as being at risk of having pulmonary embolism, it sends a message to the doctor on the screen. Have you considered pulmonary embolism? Sometimes breakthroughs come from where we least expect them. Dennis knew nothing about the hard work that's gone in for many years trying to improve pulmonary embolism testing. And to him, it was obvious. We need to test the right patients. It's been a steep learning curve. Dennis has had to learn to work in a crash course with medical data and all the associated restrictions, and many of his good ideas have been thwarted by regulation. Our research team are scattered throughout Ontario, and we've learned to work together virtually. And our highlight was earlier this year when Dennis presented our results to the Ministry of Health in Ontario. We're the only research team in the world who are working to help guide emergency doctors on who to test for pulmonary embolism. We need to test PE nudge real time in Canadian hospitals to make it the best it possibly can be at recognizing pulmonary embolism. This research has never been done before because it's challenging. We'll need to enroll hundreds of thousands of emergency department patients across many hospitals. The research will be expensive, and we're looking for funds. We're not afraid of doing this research because we know we can make a difference. Imagine this. One day, when you're taking the garbage out to the side of the road on a cold December evening, you suddenly realize that you're gasping for air. And as you walk up the stairs to go to bed, you become so dizzy and winded that you collapse to the ground. The ambulance crew take you to the emergency department, where the triage nurse records what happened. A doctor appears at your side within a few minutes because the system flagged you as being at risk of having pulmonary embolism. Within an hour of your collapse, you have been diagnosed and treatment has been started for pulmonary embolism. Your recovery takes several weeks, but you have full confidence in the medical system. You know that you're safe, and you're focused on your future. Pulmonary embolism is difficult to diagnose, and sometimes people die before the diagnosis is made. PE Nudge is an AI model designed to help emergency doctors spot people who have pulmonary embolism. If we succeed in this research, we will banish the boogeyman from the emergency department, and in the future, emergency doctors will be able to say to all people with pulmonary embolism, "We've got this. You're safe in our care. You're going to be okay." Thank you. And if I may, I would like to invite Dennis, who's in the audience here, to come and stand with me. Dr. Dennis Christopher.